Okay, team, so keep in mind, obtaining a blood glucose level utilizing a lancet and glucometer is not currently within the Nova Scotia Medical First Responder scope of practice. However, I do find value in going over how a glucometer works and how we obtain a blood glucose level as paramedics. So in front of me, I have the contents of our glucometer kit that we went over in our previous video in front of me. I also added a sharps container in here, so then after I'm done puncturing my fingertip with the lancet, I can dispose of my sharps properly. For the purpose of this video, I'll be doing a blood glucose level on myself, so I'm not going to be using any gloves. However, under typical circumstances, keep in mind we would want to apply the appropriate PPE to the patient we're dealing with. So the first thing we're going to do is we're going to obtain a blood glucose sample strip. And as soon as we put this into our glucometer, we'll hear a beep and it'll also light up. It's now going to flash and ask me for a blood sample. And the blood sample will be obtained through that test strip. And the test strip is going to act like a vacuum. It's going to suck up that blood. Next, I'm going to select a site where I'm going to puncture the skin with the lancet. And you'll notice paramedics will usually avoid selecting the center of the fingertip of a digit. We'll typically aim to puncture the lateral portion of a digit right here. If we continuously puncture the center of the fingertip, it's very painful for diabetic patients, and it can actually lead to something called neuropathy, where they'll lose sensation in their fingertips more frequently than if we were not repeatedly to puncture that site. So we'll select the index finger in this case, and I'm going to be obtaining my blood glucose sample right here utilizing my lancet. So I'm going to take an alcohol swab. I'm going to clean my fingertip. Throw that in the garbage. I'm going to take the cap off my lancet. You'll notice here, there's a red portion of the lancet with a small hole. That's the part that I depress against my skin. You're going to hear a click and a small needle drops down from the inside of that hole to puncture the skin. So I'm going to aim right here on the lateral portion of my fingertip. There's the click. I'm going to dispose of my lancet in the sharps container. You'll notice paramedics and some diabetics will give their fingertip a little squeeze to get the blood out. Now, alcohol can actually, if it doesn't dry fully, can interfere with our reading as it will dilute the blood. So take a gauze, give the fingertip and blood a little wipe, give it one more squeeze. Now we have a fresh, accurate blood sample. I'm going to take my glucometer, and the vacuum is going to suck up that blood supply into the test strip. You'll hear a beep, and then the countdown will begin to obtain the blood glucose level. You can see here my blood glucose level is 5.6, which falls within those normal parameters we talked about. So I can go ahead and dispose of my test strip now in the garbage. And that's how you utilize a glucometer and lancet to obtain a blood glucose level, or BGL.